Well, thank you all for coming today, and thank you to Eric and Joanne and the rest of the organizers for inviting me to speak, as well as for putting me in such a good, compatible, conspecific pairing for this themed talk. I'd like to share a little story with you guys today about how our lab group came to the conclusion that we really should be consistently socially housing our animals. And to do that, I'm going to tell you a little bit about why we do what we do, why we still work with non-human primates to do what we do, and basically some of the data that got us to that conclusion. So some of you may recall the first reports of HIV infection back in the early 1980s. And at that time, all we knew was that young men who were otherwise healthy were becoming ill with pneumonia caused by a pathogen that honestly should not affect people who are immunocompetent. Since then, we know a lot more about HIV infection. We know that the individuals were infected with a lentivirus. We know that they were becoming ill because their CD4 counts were tanking early on in infection. We also know the structure of the virus, and we know that by using antiretroviral therapy regimens, we're able to suspend viral replication and therefore keep these people in a prolonged period of clinical latency that allows them to live relatively normal, healthy lives. All this knowledge has led to great advances. That's huge decreases in death rates, or rather infection rates and death rates. However, HIV still remains the number 11 cause of mortality worldwide. And in case you think that this is just a third world problem, during the course of my talk, know that 3 individuals are going to become infected with HIV in the United States alone. And this is all because the virus enters a latent state in select sanctuary organs within the infected individual. And because of that, there is no cure. So to learn about the processes of latency that prevent HIV-infected individuals from becoming cured, I work as part of a team with 7 other researchers to share a very valuable resource, our SIV-infected pigtailed macaques. Pigtailed macaques, when infected with SIV, mimic many of the characteristics that we see in HIV-infected humans, including 3 stages of infection and CD4 T-cell depletion. When treated with antiretroviral therapies, just like HIV-infected humans, these SIV-infected macaques show decreased viral loads and a period of clinical latency. However, latently infected cells persist in the periphery and are established in sanctuary organs and remain there because they enter sanctuary organs before SIV, or before we treat them with antiretroviral therapies. Sorry. To mimic antiretroviral treatment in our human, as it happens in humans, and achieve the viral suppression illustrated on the previous slide in our SIV-infected macaque model, we treat our macaques daily with a combined antiretroviral therapy, as well as occasional experimental therapies. These regimens can consist of a number of different combinations of drugs, but typically include at least 1 injectable. Any oral medications are typically given in a sandwich as a powder mixed in with the peanut butter and jelly, or as a compounded tablet. Regardless of whether or not they're getting a oral antiretroviral therapy, we still always give them a food treat following their injection. And because of this, our macaques in general do come to the front of the cage to receive their antiretroviral therapy injectable pretty enthusiastically. We also have 1 dedicated non-human primate vet and a group of excellent, enthusiastic technicians who team together to work with these macaques twice a day. And because of this, they become acclimated to doing this up to 2 months before we ever inoculate them. So in the early years of doing these studies, in fact, for a full 20 years of doing these studies, we used to house these animals in pairs or groups in general population prior to inoculation, but then after inoculation, move the animals to a dedicated room for SIV-infected animals, and at that time, also separate them from their conspecific buddy. We do things quite differently now, and I'm going to talk to you a little bit about why we do that. So My focus in HIV is the role of platelets, these tiny anucleate cells in the peripheral blood that are 20 times more numerous than white blood cells. I'm interested in how platelets affect the immune response to infection, especially during the acute immune response. We know that platelets are truly first responders in the immune system. They are readily activated by common cytokines, including interleukin-6, that are present in abundance during the acute phase of HIV. Once activated, they amplify the immune response of both platelets and other cells by releasing immune-modulating cytokines such as TDF-beta and PF4 into the environment, and by exposing different proteins on their surface, such as P-selectin and CD40 ligand, that allow them to associate with other cells, both platelets and white blood cells, and change the behavior of that cell that they associate with. And though classically we think of platelets as being essential components of the hemostatic system, we are increasingly recognizing them more and more for their role as immune cells, especially in the innate immune response. We know from measuring platelet activation in the acute phase of infection in our SIV-infected macaque model that we see marked platelet activation early on in infection, specifically 10 days post-inoculation in our SIV-infected macaques, as shown by increased expression of P-selectin on the platelet surface and an increased percentage of platelets that express P-selectin on their surface. We also know that these platelets bind to a subset of monocytes called the CD16 positive monocytes that are readily infected and thought to act as a ferry for the virus into future sanctuary organs during acute infection, as well as bind to the microvascular endothelium and a number of sanctuary organs that essentially protect these latent viral reservoirs. This led me to ask whether activated platelets, by associating with CD16 positive monocytes and microvascular endothelium, might influence changes in these cells that contribute to the formation of latent reservoirs of HIV infection by influencing the ability of infected cells to enter into sanctuary organs. So the overriding goal of my research program is to determine whether platelet activation contributes to the formation of HIV reservoirs. But here is where we run into a small problem. We also know that stress may activate platelets. There's a number of small studies that are mainly associative in their design that have reported that even stress as simple as giving a presentation such as this one has been associated with an increase in platelet activation and heightened platelet response to stimulus. Because of this, oh, and I think my platelets might be activated today. Because of this, I wanted to ask whether social housing might affect platelet activation. You recall how we were doing things. We were taking our animals that had been pair-housed or group-housed prior to infection, moving them to a totally different room, a totally different social environment, and separating them from their buddy. My hypothesis was that platelet activation would occur following relocation to a new room and separation from a compatible conspecific in even uninfected animals, and that this might be confounding my research results. So I embarked on a small pilot study with all adult, male, uninfected pigtailed macaques. These macaques had been in their original housing situation, pair housing with a compatible conspecific, for greater than 3 months. And what we did is on day 0, we either left them in that situation in that same room with their buddy, or we took these animals, moved them to a brand new room with brand new macaques that they'd never met before, and separated them from their compatible conspecific. We sampled them whole blood on days 0, 7, and 10 using a technique that we use to reduce exogenous platelet activation. We measured using flow cytometry platelet activation by expression of PAC1, P-selectin, and CD40 ligand on the platelet's surface in this whole blood. And we found something that we found quite intriguing. Now, I do want to, I should have actually put the picture of the amount of activation that we see in our animals that are infected here, because you would note that the level of activation here is markedly less than what we see in our animals that are infected. But still, there's a statistically significant increase in PAC1 expressing platelets in the peripheral blood, and a trend towards an increase in CD40 ligand expressing platelets. This increase was transient, thank goodness, however. We saw it on day 7, but it had actually gone away by day 10. And this makes a lot of sense given the physiology of the platelet. The platelet has a 10-day lifespan, so this response seems to have occurred at the level of the platelets that were circulating, and then as the platelets became renewed, we see an abrogation of this particular effect. This was good for me because the main effect I saw was at day 10 post-inoculation. And we did not see a difference in, I should also note that we did not see a difference in CD4 counts, CD8 counts, or monocyte numbers of any of the different monocyte subsets, or in activation of the white blood cells in this particular pilot. So, okay, that's all well and good, but that was a very small pilot. I had a total of 4 animals in one group, 6 animals in another group. I had relied completely on the goodwill and charity of the attending veterinarian at Hopkins to allow myself access to those animals and pay those per diems, et cetera. So I decided to go and do a more extensive study with a larger group of animals and ask not only would the relocation and separation event cause increased platelet activation in these animals, but are there different degrees of stress associated with this activity? Is one element, relocation or separation, more stressful than the other, and is the effect additive? So for this, I worked with juvenile male uninfected pigtailed macaques. These macaques had been in their original housing situation for greater than 2 months prior to enrollment in the study. The study design was similar to the previous one. Apologies for the a little bit interesting. They actually were not allowed to go from room to room, as this might imply, just so you know. So our control group was once again housed in as a conspecific pair originally in the same, or as their experimental housing condition was as a conspecific pair in the same room that they were in as an original pair. And then we had 3 experimental groups. One experimental group, the conspecific pair was kept in the same room but separated from their buddy. In another experimental group, the conspecific pair was kept together but moved to another room. And in the 3rd experimental group, we replicated what we had done in the first pilot. We sampled these animals on days 2, 4, 7, 10, 21, and 30 days in terms of whole blood. And we also took hair from a patch on day 0 and on day 21, so we could get an idea of the history of stress as indicated by cortisol levels in the hair by change in cortisol. We measured platelet activation, as evidenced by our 3 favorite platelet activation markers: platelet reactivity as in response to an immune stimulant, LPS, and a pro-hemostatic stimulant, collagen, and also the formation of platelet-leukocyte association, something that we had not been able to do in the first study. And we looked at that in terms of platelet associations with monocytes of different flavors and lymphocytes, CD4 and CD8 lymphocytes. We also saved back plasma and platelet RNA in case we saw a difference so that we could look at the transcript, the effect of this on transcription. Now, I'm now going to bring you through this data, and this is one of those studies where we are going to publish it because it's very important that we get it out there, but I'm going to warn you ahead of time. It's almost all negative data. So when we looked at cortisol levels in terms of change in cortisol among the different groups, we actually saw no appreciable increase in cortisol response in the groups that had been experimentally manipulated compared to the control. We also saw no appreciable difference in platelet activation among the different groups in any of the 3 markers that we were looking at. And we saw no appreciable difference among the groups when we looked at the percentage of platelets that were associated with CD16 positive or CD16 negative monocytes. When it came to lymphocytes, we did not see a statistically significant difference, but we did see something that was a little bit intriguing, though not statistically significant. In the animals that were relocated, whether they were relocated with their buddy or separated, we did see what looked like, in the majority of those animals, a trend towards a decrease in the percentage of lymphocytes, whether CD4 positive or CD8 positive, that were associated with platelets. So we then wanted to ask whether or not this might be something that would, even though it wasn't statistically significant, was functionally significant. Were we affecting the function of these lymphocytes? When lymphocytes are activated, naive lymphocytes, they release interleukin-2 regardless of the direction in which they move next, whether it's an anti-inflammatory or pro-inflammatory lymphocyte phenotype that they take on next. So the next thing that we did is we measured the levels of interleukin-2 in the plasma of our control animals and also in our animals that we had separated and moved. We were getting to the end of our study at that point, and we had some limited resources, so that's why we only chose the two polar opposite groups. And as you can see here, we definitely saw a very real difference in the amount of interleukin-2 that was present in the plasma of the animals that had been separated and moved compared to the control, indicating that, and this was surprising to us, honestly, it indicates that a decrease in platelet binding may be associated with a decrease in lymphocyte activation. We don't know for sure whether this is a cause and effect at this time, but the possibility is intriguing. So, in conclusion, social housing may affect platelet activation, and it may affect platelet activation in different ways depending on a number of different factors. Again, we saw an increase in platelet activation in our pilot study, which was a small study that was done with adult male macaques. We saw a functional decrease in platelet lymphocyte aggregates in our GLASS grant study, and the differences that we know were present in the experimental setup of these two studies are as follows. We know that the macaques in the preliminary study came from locations that were not Hopkins in origin. So in other words, they traveled across the country, whether it was from Tulane or from Washington, to join us at our facility prior to being enrolled in our study. Now, yes, they'd gone through a quarantine period, and yes, they'd gone through that acclimation period of greater than 3 months prior to enrollment in our study, but was that really enough? Were they already ramped up in some way to respond to the change in social environment? We know that the macaque age was different as well. Our macaques in the preliminary data study were 4 years of age, while those in our GLASS grant-funded study, just because of the ones that were available at the time, were 2 to 3 years of age, and honestly, the majority of them were 2 years. All of them were male. Season was different as well. All of our preliminary study was done in November of 2011, whereas all of our funded study was done throughout the months of March, May, and June, July in 2014. And interestingly, we did have a difference in worker sex as well. 2 of our workers who collected data and helped with the moving of the animals in the pilot study were males. In fact, out of the people who participated in that study, 2 out of the 3 people were males. Whereas in our second study, all of them were females for the first 2 rounds of the study. So the take-home message is, depending on a number of factors, changes in social housing may be associated with an increase in platelet activation. And so I would encourage you as well to think about how changing in social environment may affect the parameters that you are interested in your studies, and consider keeping your animals in the same social environment that they were in prior to enrollment in your study, if at all possible, or at the very least, doing some control studies to determine whether or not a shift in social housing environment is going to affect the data that you collect. So I mentioned that we do things very differently now. Nowadays, when we bring animals in for study, it took me a couple of years to convince the rest of the group to do this, but now the way that we do it is we pair them with a compatible conspecific study buddy at least 2 months prior to inoculation, whether they come from our Hopkins farm or whether they come from an outside location. We move them to a dedicated room as a pair that we've dedicated for SIV positive and pre-inoculation animals at least 2 months prior to inoculation. And after inoculation, we leave the animals pair housed in that same room, in the same cage that they originally were in. Now, the reason why we used to do things this way is for a number of different reasons. For one thing, we'd been doing these studies for a very long time, and when we started doing these studies with non-human primates, we didn't fully understand about the transmission of HIV or SIV. So we had our dedicated SIV positive room because we weren't 100% sure that by moving animals pre-inoculation into a room, at least at the beginning, when we first started these studies, we weren't 100% sure that that wouldn't leave them at increased risk for becoming infected. Well, now, of course, we know how HIV and SIV are transmitted. We know that that's not true. So there's no reason not to move these animals pre-inoculation into the same room where they're going to be later after being infected. Secondly, we were worried about transmission between the pairs. We have not detected that yet with our sequencing data. Does it happen? Perhaps. We do know that occasionally they get into tussles. We do know that occasionally they do mount each other. But we do believe that the frequency of that is pretty low, especially in our animals that are on antiretroviral therapy. Their peripheral viral loads, the loads that are transmissible, are so very low that, and they already have their own established virus that established infection and latent reservoirs early in infection, that we really don't think that that's a real issue. And thirdly, as these animals are immunocompromised, we were initially worried as well about, oh, well, if they do become wounded due to a tussle, are they more likely to get infected? Well, with a opportunistic pathogen. Well, the answer to that is yes, absolutely, but we actually see very little fighting in our conspecific pairs, and I'll talk a little bit in a moment about how we do that pairing and how that's worked for us. So how do we find that compatible conspecific? Well, the first thing we do is we do an initial evaluation, and this is often aided by the fact that many of our animals do come from our own breeding farm. So we do get the opportunity to, and by we I mean the behaviorist that works with our group, does get the opportunity to observe these macaques' interactions with their fellow macaques in their natal group prior to bringing them down Hopkins. And if at all possible, we do try to keep them with a pairing from their natal group when we do assign them to their study buddy. In the initial evaluation, we give them we score them basically on a 4-category scoring system. We really have very few pigtail macaques that fall into the category of A. That would be an animal that was so aggressive that it would not be eligible for pairing. In fact, I don't think that we've had any at this point. Most of them fall into B1, B2, or C, and those we're able to assign them to a pairing that works relatively well using this strategy. We go through a progressive introduction. We start out with a clear panel that typically we insert in the cage, and this did not come out as well as I would have liked, but these are 2 pigtail macaques that are currently being socialized through a clear panel prior to being paired. We do the clear panel introduction for 1 to 2 weeks, depending on what our behaviorist observes. And then we go through a accelerated progression through 3 different types of fenestrated panel, a small fenestration, large fenestration, and then these bars. I would like to note as well that we actually have these panels custom made because we're having similar problems with the commercially available systems that Don had noted. So all of these do extend across the entire side of the cage, and rather than having to remove the entire panel to go from, for example, the small holes to the big holes, you can actually slide the big hole panel right next to the small hole panel and then pull out the small hole panel. So if any commercial company wants to pick up on this idea, I think that I'm going to have to talk to my boss and tell him that he should have patented it. So yeah, this is how we do it, and it works pretty well. We go through this introduction over a period of 24 to 48 hours under intensive observation by our behaviorist. We look for lip smacking and grooming through the panel, which of course would be good, and any signs of aggression and fear would cause us to either give them a timeout or reevaluate the pairing and try them with another potential conspecific. After the animals are allowed free access, they do undergo twice daily technician observations from the technicians within our lab, as well as a monthly behaviorist reassessment by our behaviorist. The daily technician observations, too, I want to stress how important those are. These are not people who are formally trained as behaviorists, although they are familiar with the different types of affiliative and non-affiliative behaviors that macaques would present towards each other. They are remarkably good, honestly, at picking up on potential problems. Of the 38 animals that we've done on study since we started routinely pair housing these animals throughout the study. We've been able to successfully keep 36 of those animals pair housed all the way to the end of the study. And that's no small feat because these studies go on for up to 2 years. So the one pair that was not successfully paired for the entire time, the people who picked up on that were our technicians. And it actually wasn't a overt non-affiliative sign that they were picking up on. It was something where we had 3 different technicians come to us and say, something's not right. I can't tell you what it is, but something is not right in this pair anymore, and we should consider separating them. We should have listened to them. The animals were just fine. They did get into a tussle, though. We separated them. We reintroduced them. They got into another tussle, and then we did separate them for the duration of the rest of the study, which at that point actually was only 1 week more. So it wasn't that big of a deal, although we would have preferred to have kept them together if they'd been compatible. So you also may recall that we give them oral treatments for many of our studies. How do we achieve that in a pair-housed animal? Well, the way that we do it is we've designed this holder that has little hard sides that are connected by a chain that's completely enclosed by the hard sides. It allows us to take the commercially available separator and pull it out to allow for a door for them to go from side to side within the cage. We do lock it to the divider so that they don't accidentally pull the divider back in and injure each other. And then when it comes time to treat them, they go to their separate sides of the cage, and they very quickly learn to go to their separate sides of the cage because that's when they get their sandwich. And then we just push the divider in, lock the divider to secure it, and they spend no more than an hour separated from each other for the entire day. And that's half an hour for their morning treatment and half an hour for their evening treatment. So though we did see differences in my particular parameters that I was interested in, looking at our current studies and comparing them to our past studies where we did not pair house our animals, we do not see a change in viral loads, we do not see a change in CD4 T cell counts, and we do not see a change in T cell or monocyte activation markers. But what we have seen are very happy macaques, and honestly, very happy technicians who work with our animals as well. I think that they're getting a lot more job satisfaction now seeing these macaques play together. So there's many people to thank for this work. Megan and Claire did the majority of the GLASS-funded study. Zach and Eric helped me quite a bit with the original pilot. Kevin and Haley also helped quite a bit. Sarah Fleming is not listed here, but that is an oversight on my part. She's our behaviorist, and she does all of the introductions for our group. And Bob Adams is the veterinarian who works most closely with our group in a clinical sense, and also the attending veterinarian who allowed me to do the initial study. Also, we would not be able to do what we do without our technicians, and this is a picture of them last Halloween, all dressed up as characters from the Peanuts. And they're just wonderful, enthusiastic individuals who really care about the animals and looking on them twice a day. And we also would not be able to do what we do if we were a smaller group, because we would not be able to fund such a large group of animals or a large group of technicians to be able to get our means. So thank you to the NIH and GLASS as well. Depending on how we're doing on time. Okay, so no questions, but thank you.